Good afternoon, everybody, and welcome back to the Compass One podcast series here at the Vizient Connection Summit. We have had a great day up here on a dock, as I like to call it, having some very interesting podcasts. And we are going to continue that trend right now. This podcast is going to be called Just the Facts, Healthcare Food Service Procurement. And helping me along this way with this journey is my two guests up here today. First, let me introduce Dawn Himes. Dawn is the Senior VP of Strategic Accounts for Compass One Healthcare. She started her career in healthcare about 35 years ago as a registered dietitian. Since then, she has served in multiple leadership roles in healthcare, including responsibilities for marketing, business insight, sales management and support, senior level operations, and clinical nutrition. Dawn, thanks for being here on our dock with us.
Great to be here.
Yes.
Thank you.
And also joining us up here is Lenny Scranton. Lenny is the division president for Morrison Healthcare. He is certified as an executive chef by the American Culinary Federation, has a background in fine dining, and is currently a division president for Morrison Healthcare, leading business in North Carolina, South Carolina, Georgia, Texas, and Florida. Lenny, thanks for joining us.
My pleasure. Thanks, Tommy.
Yeah, you guys having a good time so far at the summit?
We are.
Absolutely.
Good. Glad to hear it. Let's just kick it right off. Dawn, let me ask you, what is the role for food service procurement and GPOs for today's modern healthcare system leaders?
Well, I think when you consider food purchasing and procurement, it typically is quite a small percentage of the overall food service budget, the hospital budget, and it generally runs about 2%. The key is, however, the choices that you make around food procurement really have a huge impact upon your patient experience and your customers. And I think a lot of the conversation is around cost, it's really about what happens to that food once it's procured,
right,
and how does it tie into your initiatives in terms of your organization, whether it be the focus on patient satisfaction, regulatory requirements, nutritional requirements, et cetera.
Gotcha. Okay. Len, you got anything to add to that?
Yeah, I would say that, the role varies depending on who you're talking to. And oftentimes we've got two customers in healthcare. We'll have, an operations customer, a COO or a VP of operations, and then we've got supply chain customer. And they've got two totally different lenses they're looking at. In most cases, supply chain's looking very specifically at the end-to-unit pricing,
okay,
the raw material pricing,
yeah,
which is a very small piece of what we do, being in the service industry. Whereas our operations customers, they're looking at the total operating budget of the service we provide. So a very different value base that they're looking for.
Okay. Hospital leaders, when they view food service procurement, touched on it a little bit, but expand upon it for me, if you will.
So, I think the C-suites, they're looking at the overall value of the total service.
Okay.
Not just the price of the food coming in the back door or the management fee that we charge, but what's the value of the service as a whole? When we look at just the raw product coming in the back door, that's really only about 30% of the overall picture when it comes to food cost.
No.
Food is pretty unique in that most times we're not buying a ready-to-use single portion item like many things that supply chain procures. We buy, a chicken breast and it's got to be cooked and you're going to have some shrink involved. Then it's got to be portioned. It's got to be portioned correctly. So in most cases, you're dealing with, 12 to 15% shrink. And then you've got the portion control aspect of it as well. And then the service component that falls on top of that.
Yeah. Okay. Are those kind of, I guess you would say, like some blind spots when it comes to culinary operations?
Absolutely.
Yeah.
Absolutely. From a chef's perspective, we're really thinking menu first.
Right.
What's the actual center of the plate going to be? And then how do we carry that through to supply chain? And it's probably one of the more unique aspects of the way we go to market with supply chain is we're really a culinary-driven organization. Culinary drives the menu. We work through clinical nutrition to drive the clinical component. And then we take it to supply chain and we ask them to go to the manufacturing community and contract a spec. Yeah. Completely opposite of most GPO organizations.
Okay, interesting, yeah. Dawn, let's switch over to you. From the financial performance side, speaking of GPOs, where do GPOs like Food Buy add value?
Well, we know values in the eye of the beholder. So certainly within our customer base, each of our customers have different initiatives and priorities organizationally, but also as it relates to their food procurement. Some of our clients are truly focused on the cost aspect and the patient experience component. And so what our Compass Food by GPO has to offer is a myriad of menu choices,
Right.
pun intended,
Right.
so that they can really take a look at their organizational priorities. Another area that they might be focused on might be sustainable purchasing, as well as diversity suppliers and also local purchasing. So the great news is we've got that capability to look at all of those impacts. The other thing I would say is from a value perspective, again, we focus a lot on the price, but I think a lot of what is important is looking at that cost predictability over time. And as you have a partnership, what's going to happen when inflation hits? What's going to happen when manufacturers increase prices? What's going to happen if a distributor decides to increase their delivery cost? So how do they mitigate those costs over time?
Yeah. Interesting. There's a lot to take in with all of that.
Certainly.
For sure. Yeah. Lenny, let's switch over to you now. And what happens when there's a disconnect between operations and procurement?
Well, we've dealt with a lot of that over the
Yeah.
last couple of years for certain.
Yeah.
So I think when there's a disconnect, there's certainly a missing accountability, most certainly. Who's making choices when there's a disconnect? Because being a chef-driven organization, I want to know who's driving the spec when there's a supply chain disruption.
Mm-hmm.
How does that change in spec or change in decision? How does that impact the nutritional analysis? How does it impact the allergen statements? How does it impact the safety of the patient or the caregiver that I'm serving? So there's a lot of risks involved when there's not that direct line of connection between ops and supply chain.
Yeah. Dawn, do you have anything to add to that as far as the disconnect between operations and procurement?
Well, I think the patient safety aspect is one of the most important
Sure.
to consider, and the integration of your food procurement with the management of your food service operation, because a lot can happen from the time the food comes in the door to when it's actually served to a patient. And so the integration of systems as it relates to production, as it relates to your nutrition analysis software, identifying allergens, those are all critical things beyond the cost aspect that I think need to be considered.
Gotcha. Okay. I got one more good question for you guys. Lots of leaders out there are evaluating food service procurement proposals or market basket comparisons. What questions should they be asking to make sure they are maximizing value and protecting themselves and their patients?
So the interesting thing about market baskets is they are a point in time analysis. They will tell you today what's available and what compares to your current procurement program.
Okay.
Again, the question really is, what happens over time? What happens if there are product shortages? What's substituted? What happens when inflation hits in the next 3 to 5 years? The market baskets don't tell you that.
Okay.
So beyond the market basket, I would strongly advise look beyond the market basket, because that's really just a point in time of today.
Okay. Lenny?
I mean, for me, I always want to look beyond just the price point, period. I mean, it's so easy to commoditize what we do with food, but the first thing on my mind is always safety, remembering that we serve a immune compromised population every day of the week.
Sure.
And if you just look across our population base, even with the caregivers, there's more allergen sensitivity than we've probably ever dealt with. So it's just critically important that we know exactly what we're serving, how we're serving it, and the role that it plays in the recipes, and the role it plays in clinical nutrition. So patient safety, caregiver safety is always first and foremost. And, anything from flagging, the sodium content to the texture itself and how that impacts a recipe is critical.
Yeah, so much goes into all of that. I mean, it really does. It's interesting to talk and hear you guys talk about it. I'll throw one more question out there for you in the future, healthcare food service procurement. Where do you kind of see the future of it going? What can you anticipate coming down the road and how it might change?
I think one aspect is really around the reliability of the supply chain.
Okay.
I'd be remiss if I didn't mention the pandemic. I know we're on the other side, so to speak, but what happens when things go wrong? What happens when you can't get the food products that you really need for your patients? And when you partner with larger organizations and you focus on that scope and scalability in terms of their procurement, they can provide that reliability as well. And I think that's a very important thing for all of us to keep in mind.
Yeah. Lenny?
I think really the future of purchasing when it comes to food is going to shift more towards value-based purchasing and looking beyond just the price point, but looking at how the food was produced, how it was sourced, who grew it, where it was grown, and what care was taken in it. As a chef, I'm very particular about the food that we put on the plate. The food it's our reputation. It's our brand integrity. It's what we ride on every day. But more and more, our customers want to know the story behind what's on the plate. They want to understand, did you buy it from an MWBE supplier? Did you buy it from a BIPOC producer? What's the value that came with that product? So being able to tell a story beyond just putting a product on the plate, I think is going to be a very big piece of what we do moving forward in the future.
It's fair to say that I think more people are becoming educated about where food comes from, not just the people on our side of the business, but the customers and the patients especially. Is that fair to say?
Most certainly. I mean, all you've got to do is look at higher education and the customers they serve today and the college students and what they're asking for and looking for. And that's the customer that we're going to be serving 4 and 5 and 6 years from now. And they've got very high expectations.
Yeah.
In other words, our patients are the consumers.
Yeah. Yeah, 100%. Lenny and Dawn, thank you so much for taking your time to join us up here on our podcast doc. And we appreciate everything you guys are doing. And thanks for joining the podcast.
Thank you.
Great.
My pleasure.